This is the VOA Special English Health Report. Heart disease is the world's leading cause of death, yet most cases can be prevented. Doctors say reducing deaths from heart disease will require not only changes in the way people live, it will also require changes in public policy and better public knowledge about differences in heart disease between men and women. Two conditions, coronary artery disease and microvascular disease, can both reduce blood flow to the heart. Experts at Brigham and Women's Hospital in Boston say heart disease in women is more likely to be caused by microvascular disease. Finding this condition may require tests other than an angiogram. An angiogram is a kind of X-ray test. Doctors use it to look for a buildup of fatty plaque material that can block arteries. Arteries carry oxygen-rich blood away from the heart to the rest of the body. The World Health Organization says heart disease kills 18 million women a year. And these are not just older women. Carrie Vincent had a heart attack after giving birth to her first child at the age of 31. Ms. Vincent is now taking her message to women at meetings in their homes through an organization called Sister to Sister. Irene Paulin started Sister to Sister to educate women about heart disease. Ms. Paulin urges women to learn about their blood pressure, cholesterol levels, and other risk factors for heart disease. Ms. Paulin teamed up with a heart specialist at Brigham and Women's Hospital. Dr. Joanne Foody works mostly on prevention efforts. She says, "The good news is we know that 90% of heart disease is preventable by reducing risk. That means not smoking, and it means controlling or avoiding diabetes. It also means keeping a healthy weight and eating healthy foods. And it means exercising at least 30 minutes on most days and managing or reducing stress." Dr. Dariush Mozaffarian at the Harvard School of Public Health also has other advice. He says people should eat more fish, whole grains, vegetables, vegetable oils, and nuts, and reduce the amount of salt and trans fats in their diets. Trans fats can increase the risk of heart disease. Heart disease increasingly affects women in developing countries. Dr. Mozaffarian places a lot of blame on the global epidemic of obesity. He says people are getting chronic diseases not from eating too much, but eating poorly. And so, in fact, what they're not eating is actually probably mostly what's harming them. For VOA Special English, I'm Alex Villarreal.
It was this landmark study, published in 1953, that radically changed our view about the development of heart disease forever. A series of 300 autopsies performed on U.S. battle casualties of the Korean War. Average age, 22. 22 years old, but 77% of their hearts had gross evidence, meaning visible to the eye evidence of coronary atherosclerosis, hardening of their arteries. Some of them had vessels that were clogged off 90% or more. As an editorial in the Journal of the American Medical Association concluded, this widely cited publication dramatically showed that atherosclerotic changes appear in the coronary arteries years and decades before the age at which coronary heart disease becomes a clinically recognized problem, before symptoms arise. Follow-up studies on the hearts of thousands more soldiers over the subsequent years confirmed their results. How young does it go? Fatty streaks, the first stage of atherosclerosis, was found in the arteries of 100% of kids by age 10. What's accounting for this buildup of plaque even in childhood? In the 80s, we got our first clue, the now famous Bogalusa heart study, looking at autopsies of those dying between the ages of 3 years old to age 26, and the #1 risk factor was cholesterol. You could see the stepwise increase in the amount of their arteries covered in fatty streaks as the level of bad cholesterol in the blood increased. As powerful as this was only looking at 30 kids. So they decided to study 3,000. 3,000 accidental death victims, ages 15 through 34. After thousands of autopsies, they were able to produce a scoring system, able to predict advanced atherosclerotic lesions in the coronary arteries of young people. The higher your score, the higher the likelihood you have these lesions growing in your heart. So if you're in your teens, 20s, early 30s, and you smoke, your risk goes up a point. If you have high blood pressure at such a young age, that's 4 points. If you're an obese male, 6 points. But high cholesterol was the worst. If your non-HDL cholesterol, meaning your total cholesterol minus your good cholesterol, is above like 220, that's like 8 times worse than smoking. So let's say you're a young woman with relatively high cholesterol, but you don't smoke, you're not overweight, your blood pressure and blood sugars are fine. At your sweet 16, there's just a few % chance you already have an advanced atherosclerotic lesion in your heart. But if you don't improve your diet, by your 30th birthday, there may be like a 1 in 5 chance you have some serious heart disease. And if you have really high cholesterol, it could be closer to 1 in 3. Bringing your cholesterol down to even just that of a lacto-ovo-vegetarian, and you're down to here. And if you exercise to boost your HDL, you can extrapolate down a little further. So what this shows us is that even in 15 to 19-year-olds, atherosclerosis has begun in a substantial number of individuals, and this observation suggests beginning primary prevention, at least by the late teenage years, to ameliorate every stage of atherosclerosis and to prevent a retard progression to more advanced lesions. You start kids out on a low saturated fat diet, and you may see a significant improvement in their arterial function by 11 years old. Exposure to high serum cholesterol, even in childhood, may accelerate the development of atherosclerosis. Consequently, the long-term prevention of atherosclerosis might be most effective when initiated early in life, as in 7 months of age. Atherosclerosis, hardening of the arteries, begins in childhood. Remember, by age 10, nearly all kids have fatty streaks, the first stage of the disease. Then the plaques start forming in our 20s, and get worse in our 30s, and then can start killing us off. In our hearts, it's a heart attack. In our brains, it's a stroke. In our extremities, it can mean gangrene. In our aorta, an aneurysm. If there is anyone watching this video that is older than 10 years of age, the choice likely isn't whether or not to eat healthy to prevent heart disease. It's whether or not you want to reverse the heart disease you already have. Ornish and Esselstyn proved you can reverse heart disease with a plant-based diet. But we don't have to wait until our first heart attack to reverse the clogging of our arteries. We can start reversing our heart disease right now. We can start reversing heart disease in our kids tonight. Medical myths and dogmas die hard. Researchers creating a new body of knowledge for prevention and control of heart disease had to disprove and displace a bunch of doozies. Like we used to think that heart disease was just an inevitable consequence of aging, or that cholesterol and blood pressure just naturally go up as we age. All these are now bygone notions, refuted by massive data, but other long-standing myths and dogmas about our #1 killer epidemic persist. For example, this notion that major risk factors like cholesterol account for a minority of risk, and that many people have heart attacks with no risk factors, so it's just kind of a crapshoot, not much we can do about it. Wrong. There are rare genetic conditions that give people high cholesterol no matter what they eat, but such genetic defects occur in no more than 1 in 200 people. This means, of course, that most persons with atherosclerosis acquire it by what they put in their mouth. The InterHeart study showed that for men and women, old and young, in all areas of the world, 9 potentially modifiable factors like diet, exercise, and smoking accounted for more than 90% of the proportion of the risk of having a heart attack, and this has been confirmed in prospective studies. Follow men over time, and those making healthy lifestyle choices associated with a 90% drop in risk. Same with women. 92% of the risk gone. Same with diabetes. 91% of cases could be attributed to bad habits and behaviors. And the same healthy lifestyle, which includes not smoking, eating a healthy diet, exercising, maintaining an optimal body weight, may reduce the risk of multiple chronic diseases at the same time, not just heart disease and diabetes, but stroke as well, up to 80% of strokes avoidable with simple lifestyle changes. How does this all compare to drugs? Why change our diet, lose weight, start exercising if we can just pop some pills? Pharmacological therapies, including cholesterol-lowering statin drugs and blood pressure pills, typically only reduce cardiovascular disease risk not by 90%, but only by 20 to 30%. So even on drugs, 70 to 80% of heart attacks still occur. One of the great things about this study, the Harvard Health Professionals follow-up, is that they also looked at the effect of lifestyle changes on people already on medications. Even those on blood pressure and cholesterol-lowering drugs may still be able to get a further 78% drop in risk by eating and living healthfully. So the choice isn't diet or drugs. Cardiovascular medication should be used as an adjunct to, not just a replacement for, healthy lifestyle practices. It takes time for new science to trickle down into mainstream medical practice. The practice of cardiology and medicine in general may correspond on average to what was being published 10 or 20 years before. So it's important to know if your doctor is still stuck back practicing 20th century medicine.